So we're delighted that our second speaker is Charlotte Bullard. Charlotte's going to be speaking about mindset, resilience, and the perception of or reaction to workplace challenge in registered veterinary nurses. Charlotte began her career in equine science before finding her niche in education. First programme managing for an equine training provider in Suffolk, overseeing and teaching equine therapy and veterinary nursing students. Charlotte later joined the British Veterinary Nursing Association as education manager in 2019. She's due to complete her MSc in veterinary education from RVC in autumn 2021, where she completed research on mindset and resilience in RVNs. So absolutely delighted you can be here, Charlotte. One of the things we've said every year at the symposium is we really, really, really want more research on registered veterinary nurses, and I'm so pleased to have some here today. So really great to hear that, and welcome, Charlotte.
So thank you very much for the opportunity to discuss my research. I'm pleased to say that I did complete the MSc, so that title has now changed, but so I will try my best to stay to time, but I am really, really passionate about this area of research, so I apologise in advance if I rattle on for longer than anticipated. So just to provide some context for our research, so we know very well that veterinary workplace stresses are already very well documented, and also specifically within RVNs as well. But what we don't know are the responses, so the feelings, the thoughts, the behaviours that these sorts of stresses start to elicit in RVNs. The other thing that we're aware of is stresses are, again, well reported, but the use of that term, while valid, is inherently quite negative. And we wanted to take an appreciative inquiry to this study. So we wanted to think about what nurses are already doing well to navigate challenge in the workplace, and how we can equip nurses to thrive, not just cope, but thrive under challenge in the workplace. And the reason that we wanted to focus really on challenge as opposed to stresses is if we think about the environment that nurses are navigating through their work, we can start to look at these intrinsic and extrinsic motivators. So veterinary nursing is a career that is known to be highly intrinsically motivating. So nurses find that work that involves caring for animals is very motivating, that their work is meaningful, and those feelings that work actually makes a difference. Now, the key thing here is actually quite a lot of that work can be really challenging at times. So it's really important that we don't actually forget the positive impacts that challenge in the workplace can have. Sorry about that, that progressed more quickly than I anticipated. The other thing that we need to think about is these extrinsic motivators. So things like work conditions and culture, things like pay and feeling respected and valued both within the profession and also by the public, quite often can feel quite out of control for nurses. And part of mitigating workplace challenge is also mitigating the wider context in which they work, and being able to navigate the fact that some of these will feel out of control is also really important when we start thinking about resilience. So just starting off with mindset, first of all. So mindset, and particularly growth mindset, was a concept developed by Carol Dweck. And it's all about thinking about how open we are to learning under certain situations. So if we think about approaching a novel situation or indeed a challenge in the workplace, an individual who has a growth mindset is characterized by being inquisitive. They will approach this situation as an opportunity to learn, and indeed they see failure as an opportunity to learn also. They will approach the situation optimistically, and they also believe that knowledge and ability can always be improved. Whereas if we think about fixed mindset, they may perceive the event as being stressful and threatening. They may approach the event pessimistically. They have a fear of failure and anxiety associated with that. And they also believe that knowledge and ability are fixed traits. Now, this feels very black and white, but what we also know is that different situations will elicit different types of responses. So we will all have elements within our personality that are growth mindset, elements that are fixed, and there will be different stimuli that will bring about those sorts of responses. But for the simplicity of this study, we're going to look at it in a relatively black and white perspective, but it's just important to know that it's not always quite as clean cut as that. So why growth mindset? Why is this relevant to the veterinary profession? So there has already been existing research that's been carried out on veterinary students. So this has found beneficial effects on psychological well-being, on stress, on anxiety and fear of failure and perfectionism traits. However, we don't know as much about mindset typing in RVNs. And the argument could be, well, we know this is the case for vets and vet students, why can't we just apply this to veterinary nurses? But whilst they work naturally in that same challenging environment, there are differences in their background, their education and that professional hierarchy that means that their approaches to approaches to learning in the workplace are likely to differ between the professions. So we need to explore that further. Then moving on to resilience. So naturally this, rightly so, is a bit of a buzzword in the profession, and it has been for some time already. It's quite a complex concept. So the description that we're going to use for resilience is the ability to respond to stress in a healthy way at minimal psychological and physical cost. So naturally, this is really, really important to success within the veterinary profession, within the veterinary workplace. The fact that it's included within the day one competencies means that there is a responsibility with the individual to be able to recruit those appropriate strategies when they need to. So we need to be able to equip nurses who are entering the profession with those strategies within their training. And again, resilience is really important because it enables that professional engagement, it enables that satisfaction and well-being. And therefore, if we're going to expect individuals to be successful within the veterinary professions, then we need to equip them with resilience strategies. And of course, we're also looking at career staying power and retention as a result of having that resilience. However, and again, there's little actual research that's gone into this, but empirical evidence suggests that many RVNs don't feel sufficiently prepared with those resilient strategies when they enter the profession. So it could well be that during their training, they perhaps don't realise how important they are. It could well be that there isn't enough of a, what I'm looking for, there isn't enough within the training to be able to recruit those strategies when they do enter the profession. And also, despite there being a wealth of information now, a wealth of research about resilience already, we also know that lots of veterinary professionals do actually struggle to apply those principles in their professional practice. So what is it that's stopping them from being able to do that? So what we wanted to do is achieve an overview of what that looks like. What does growth mindset look like in practice? What does high resilience look like in practice? And the reason that I like these two aspects together is a growth mindset enables an individual to navigate that challenge effectively, and resilience enables that individual to then recover from that challenge, from that stressful event. We know that stress is inevitable within the veterinary workplace. So what we need to do is be able to equip individuals with those strategies to enable them to both navigate and recover from those stressful events. So how are these behaviours actually expressed in day-to-day practice? And is this something we can teach? And ultimately, if we understand these behaviours better, we can start to build these appropriate strategies into the veterinary nursing curriculum early on, so that individuals have the opportunity to really build on those before entering professional practice. So just to summarise, our research aims were to describe mindset and resilience in a cohort of UK RVNs, to relate those characteristics to each other and also to perceptions of workplace challenge, and to explore the types of challenging events that RVNs find motivating and satisfying or demotivating and draining, and also to determine the type of actions taken as a result. Too far. So I'm just going to breeze through my method just for the purpose of time, but if anyone has any questions, please do feel free to ask. So for this study, I utilised a single methods approach, which was a questionnaire. However, there was a quantitative and a qualitative aspect to this questionnaire. So starting off with the quantitative data, we yielded demographic data. We used a mindset typing inventory that was developed by Dweck, but it's been used more recently in veterinary context by Bostock et al. In 2018. And we also used a resilience scoring inventory, which was the brief resilience scale, and this was developed by Smith in 2008, but also used later by Crane in 2015, again within veterinary context. And then moving on to the qualitative section of the questionnaire. So we had a reflection framework which asked individuals to describe a motivating and satisfying challenging event in the workplace and a demotivating and draining challenging event in the workplace, and that's to have occurred within the last 4 weeks. So this was asking questions such as what happened, how did it make you feel, what did you do next, what did you learn from the event? We also gave respondents the opportunity to answer if they couldn't think of either of these events as well. So obviously it's quite important for us to know if individuals can't think of events that have particularly motivated them at work. And we also asked them to think about the perception of the proportion of motivating versus demotivating challenging events in the workplace. So again, if we're thinking about resilience, knowing that they experience more demotivating events in the workplace is obviously critical with that as well. So moving on to how we analyse the qualitative section of the questionnaire. So we looked at this in 3 stages. So firstly, looking at the type of challenge, so whether it involved a client, the veterinary team and management, the respondent as an individual or a patient. We then looked at used thematic analysis to describe the evidence of a range of growth mindset traits. So we can see this within the table on the left-hand side here. These were the traits that we were looking for. And then finally, we used thematic analysis to describe any evidence of resilience traits that were shown within the responses. So again, these are on the right-hand side here. And again, if the respondent showed no evidence of those, then we indicated that as well. So just to summarise the demographic data and also what this looks like in terms of overall mindset and resilience. So we had 52 respondents, so this is quite a small sample, but we know that engagement across the profession has been reasonably challenging so far, but it did give us enough data to be able to work with. Naturally, there was a very high proportion of female respondents, but this is proportionate with what we also find within the profession itself. The average mindset score was indicated as being a growth mindset, and what's really interesting here is that the vast majority of respondents either categorise themselves as being a growth or a strong growth mindset. Our average resilience score came back as normal, but I should add as a caveat to that, it was the low end of normal when we're thinking about how we categorise those scores. So while the majority demonstrated a normal resilience score, we can't ignore the fact that effectively a third of our respondents demonstrated a low resilience score, and we'll come back to why that might be in a little while. But what we did find is that there was no correlation between mindset scoring or that brief resilience score with age, time in practice or career entry route. Now, early results suggested that there may have been a weak correlation between mindset and resilience. However, the final results showed no correlation between the two at all. And again, we'll come back to why that might be in a little while. We also looked at what this means if an individual has a growth mindset or has a higher level of resilience, what this means for their career satisfaction. So there was a significant positive correlation between the two and career satisfaction. And what we also found was that there was a positive correlation between mindset scoring and perceiving a greater proportion of motivating events in the workplace. So it's kind of a chicken and egg situation. Does the fact that they experience more motivating events lead them to a growth mindset, or does actually the growth mindset enable them to perceive more challenge as being motivating? Now I'm going to just focus on the types of demotivating challenge just for the purposes of time. What was really interesting, and actually it was kind of a surprising result, but then it really ties into a lot of the themes that we've already discussed today, the most prominent theme that we found when it comes to demotivating workplace challenge surrounded the veterinary team and management, and obviously culture has come up an awful lot today, so that was a really interesting finding, and then followed by client interaction. Now this slide summarises the occurrence of those growth mindset traits. So within the qualitative section of the questionnaire, this just describes how prevalent those traits were within our sample. So we found that naturally those with a growth and a strong growth mindset demonstrated one or more growth mindset traits within their responses more frequently than those with a fixed or a strong fixed mindset. What was interesting, however, is despite growth and strong growth individuals reporting themselves as such, there was still quite a significant proportion of those that didn't demonstrate evidence of those traits within their responses. And again, we'll come back to why that might be in a little while. And again, similar pattern here. So normal and high resilience individuals showing or demonstrating evidence of those responses, or those traits within their responses, sorry. But again, we've still got a significant proportion there that are normal or high resilience, but don't demonstrate those resilience traits within their responses. So as I mentioned, it's unsurprising that we would see a greater level of growth mindset and resilience traits within these two groups on the left-hand side. But how do we explain the individuals that don't show those traits whatsoever? So one possible explanation for this could be a false growth mindset. So Dweck revisited her mindset concept in 2017, and this is where individuals claim to have a growth mindset, but this isn't reflected in their actions and behaviours. So they may claim that they've got a growth mindset because they believe that this is the correct way to be, but it's not a true representation of their actions and behaviours. So this is the sort of thing that we're starting to see within their responses. So that kind of explains the false growth mindset in the mindset data, but how can we explain the same within the resilience data? And one way that we could look at this within the literature is espoused theory versus theory in use. So espoused theory is the factors that individuals think, believe, drive their behaviours, so those motivators for those behaviours. Whereas theory in use are factors that actually drive their behaviours, and crucially, quite often there's a lesser degree of awareness around these. So when we're thinking about the complex veterinary environment, there may be a whole host of theories in use that may be competing. So one example of this could be a veterinary nurse that believes that they are resilient, but actually put the needs of their colleagues above their own, and then that stops them from being able to perhaps employ those strategies quite as effectively. So one way that we can start to look at this, look at targeting this and how we bridge that gap, is through reflective practice. So this has benefits to growth mindset because it enables the individual to appreciate other people's perspectives or alternative approaches. It helps us with resilience because it enables those individuals to more constructively process emotions. So again, really important when we're bouncing back from stressful events in the workplace. And then if we're thinking about how we bridge that gap between espoused theory and theory in use, we can start to use critical analysis frameworks. So there is already one in place that's in a human care setting about how this can bridge that gap, but it is possible to apply that within the veterinary setting as well. So we quite often use these reflective frameworks when we're thinking about critical incidents in the workplace, but we can also use that internally. And I guess that's where the challenge comes in. When we're feeling challenged, when we're feeling under pressure, it's human nature to close down, whereas actually this is really testing that growth mindset, because we're having to remain open to learning even when we're under pressure and we're under stress. I'm just going to quickly breeze through the limitations. So this study adopted an interpretivist approach, which basically means that as the researcher, I had to interpret what was important and what wasn't important about people's reflections of the events. And the respondent also had to interpret what was expected from them in the reflective framework as well. So one way that we could get around that in more detail is through the use of structured interviews. This just enables us to gain that greater level of understanding that isn't always possible just from a questionnaire. And naturally, small sample size, which I've already mentioned. And also we just need to think about, are the questions that I'm asking directing them towards the information that we need? So we did a pilot to make sure that that was the case, but there is always that risk that the respondent has not understood what we're asking from them in their response. So just quickly to run through the conclusions. So this was the first, to our knowledge, to look at mindset and resilience in RVNs, but also look at how that impacts response to workplace challenge. There were positive outcomes that are associated with those traits, which support their inclusion in the curriculum. Our results indicated that there is that gap between espoused theory and theory in use, and we can start to employ reflective practice to help those individuals to overcome that. As an extension to this study, we could look at using structured interviews so that we could understand these aspects much more clearly. And we also need to think about how, especially with the results that we got around the team and management, think about how the relationship between team dynamics impacts both growth mindset and resilience, and are there any strategies that we can employ as a team to improve those two. So that is it. Thank you so much. I'm so sorry I ran over time slightly.
That's absolutely fine, Charlotte. Thank you. Really fantastic study, and thank you for doing this work on veterinary nurses. It's so important, and it's so under researched as an area.